On this week's episode, Dr. Mike shows us 5 all-natural treatment options for neck pain.
Hi, and welcome to this week's episode of the Wellness Lab. I'm Dr. Mike from the Springfield Wellness Center, and what we're going to be talking about today is neck pain. So neck pain presents in a variety and a number of different fashions, and typically it'll come in on one of two things. We're looking at either acute injuries, so think about somebody that gets in a car accident, they're doing CrossFit, doing handstand push-ups, and they come down a little too hard or fall down too hard on their head. Or we look at more chronic type things, and with those chronic repetitive stresses, that's something that's going to build up time and time and time again. Somebody that sits at a desk with their head in a real funky position for 5, 10, 15, 20 years at a time, that would be a little bit more of a chronic type thing. Or we could look at injuries from the past, car accident that somebody had when they were a teenager, and then now here we are 20, 30 years later starting to present with some symptoms, probably some arthritic type things in there as well. The foremost method of which we employ dealing with neck pain here in the office is the chiropractic adjustment. It is the foundation of the care that we provide here at the Springfield Wellness Center. We have lots of other facets and different things that we can employ into it as well, but first and foremost we want to work on getting that spine and that nervous system functioning properly. Here at the office, we have 3 different ways that we can deal with and help with neck pain. In terms of the adjustment, the first one that we can use is called the activator. It's a handheld adjusting tool, and what it does, it delivers an impulse into the muscle, into the joint. It's a very light force, low force adjusting tool and technique. Dr. Rob and myself are both certified in using the activator technique, and we have certain individuals that come in asking specifically for it because they want that lighter force adjustment, or they've had that care at a different office that they've been into. Another way that we can do an adjustment for the neck is from a seated position, and so I have my lovely assistant Kayla here, and so with the seated adjustment we can either do it just sitting straight up on the table here or in one of the other chairs we have in the office. This is a really good effective way to adjust somebody that can't relax in a laying down position, or perhaps can't lay down at all. Very late stage of pregnancy, women can't be on their back for an extended period of time. This is a really good effective way that we can do an adjustment from the seated position versus lying or versus the activator. Go ahead and lay on your back. Last way that we can do an adjustment for the neck is from the supine or laying down position here. And so we have them lay in this position. We determine where the subluxation exists, so where we're finding that lack of motion and that tight tender fibers. And then very, very gentle, slight little push, we deliver the adjustment. A lot of people talk about the adjustments thing as a big twisting motion and that kind of stuff. Very, very, very safe and effective when we're performing the adjustment. Cervical traction is an effective way to help deal with neck pain. So if we're talking about just general neck stiffness, maybe somebody talks about a very compressed kind of feeling in their neck. Also really good when we're talking about disc bulges, herniations, or pinched nerves, that sort of thing. And so we have our traction table here set up for cervical traction, and I'm going to demonstrate that in just a few moments. But what we're looking at and affecting with this is stretching out the joints of the neck. And so as we stretch and open up those joints, we can be pulling pressure off of those nerves, we can be reducing inflammation, as well as, if we're talking about like a pinched nerve, pulling a little bit more pressure off of that nerve. And so I've got my lovely assistant Allie here, and she's going to help demonstrate for us here. So I'm going to have you lay on your back. Place your head on this little pad, neck between the 2 little goalposts, and so we get her set up in a position to where the little pads are sitting on the outsides of her skull. We're going to strap her into the machine. And then once this starts pulling, what's going to happen is that it's going to stretch and pull to a point, relax back down, and what we're doing is just oscillating back and forth between those two. We're trying to pump those discs that, like I said, pump out some inflammation, or like even if it's just a case of kind of just stretching those joints out, elongating those joints to help reduce some stress and tension through the neck. Electrical stimulation, or electric stim, is a method that we will help to employ with different types of back injuries, specifically today talking about neck pain. And so what electric stim does is we use these little pads and we place them in different areas of the spine depending on where the major trouble spot is. Speaking specifically about neck pain, majority of the time we're talking about the traps all the way up to the back side of the skull, where the trapezius muscle sits. People talk about, they get stressed, they get a lot of tension into their neck and their shoulders, into this area here. This is a really effective way to help to decrease that muscle tension. In addition to the stimulation pads that we put on, we also include ice with that as well. Reason being, those joints can get irritated, they can get a little bit inflamed. That ice is going to help to decrease that inflammation, decrease that tension that we're experiencing. And so I'm going to set up here. So we're going to go across the traps. And then, like I said, up to the back side of the neck here. And so with this, when we start to turn it on, what the patient is going to experience is going to be a light tingling sensation. That's always how I explain it. You're going to feel a little bit of a tingling sensation in through those pads. I ask them to tell me when they first start feeling it so we can get kind of their baseline, and then also for their tolerance level. So with this, we don't want it to be extremely uncomfortable, painful. It shouldn't be grabbing or pulling at the skin, but it can get to that point if it goes too high. So we always have to make sure that we communicate that back and forth as to how it feels, what it feels like. Put the ice pack on, and then once the treatment starts, what it's going to do is going to oscillate back and forth and move back and forth between those pads. One will kind of pull at you, one will kind of pulls, moving around, helping to decrease the muscle tension that we're experiencing through the neck and the upper back to help alleviate some of those symptoms. Graston is another very effective method that we can help to deal with neck pain. So Graston itself is an instrument-assisted soft tissue technique, and so we use these metal tools in conjunction with a massage gel or some kind of a heating gel to help to get in, break up scar tissue, and relieve some adhesions and just extra tight muscles. And so my new assistant this time, we've got Brooke here, and so I'm just going to kind of go through and show what we would do working with neck pain with the Graston tool. So normally I would apply some, like I said, some type of a gel in here, and we're just going to kind of demonstrate it here. But working across through the trap and then up along the side of the neck, taking the tool and just applying some pressure in and moving it back and forth in this manner. And so as we're doing this, we find certain spots that feel almost kind of gritty and gravelly. That gritty, gravelly sensation is basically scar tissue that's built up in those muscles from acute injury, chronic injury, kind of like we've talked about previously. And so as we get in and start working this in, I'm obviously going to be asking Brooke, how this feels, that kind of thing. What we can have her do is we can have her tip her head away a little bit further. We can increase some of the tension, hit some different areas. You can see how the muscles kind of move a little bit differently as she moves. And then we work our way up into the neck as well. With this, the entire treatment itself is only going to last maybe a minute to 2 minutes, because as you can see, her skin is starting to redden up really, really good. And so when we do that, what we're doing is that means we're increasing blood flow to that area. If we continue past, and I would go for minutes and minutes and minutes at a time, we could end up actually bruising the skin. So we always make sure we stop short of that, so we're still getting the effects without actually causing any increase of injury. Massage is an effective technique for dealing with neck pain. When we're talking about massage, we're looking at breaking up scar tissue, breaking up muscle adhesions that can be limiting either range of motion or can be limiting the ability for the adjustment itself to hold and stay in place. The massages that we deliver here at the office are not the typical spa type massages. We're very light pressure, a lot of brushing strokes. This is a little bit of a deeper pressure type massage, and the reason being is that we're trying to affect at that muscular level the amount of tonicity, the amount of tension that we're finding and seeing within those muscles. We recommend here at the office that individuals will get sometimes, and depending on situation, get a massage in conjunction with their chiropractic adjustments. So that way we're hitting things from both the chiropractic joint side of things, but then also from the massage muscular side of things. And what it does, it helps to ease that transition into care. It helps to get results a whole lot faster, and as well as helps to hold that adjustment in place a whole lot longer.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week I want to show you a band distraction technique that you can do to help with your shoulder mobility, as well as stretching out your trap. A lot of times if your traps are really tight, you're going to feel a lot of tension in your neck as well. So if you're having neck pain, it also could be coming from your trap. So that's what we're going to work on today. So you're going to need a band kind of like this, anchored pretty high. What you're going to do is take your the arm, so the arm that's furthest away from the band, you're going to put it behind your back, and you're going to loop it through the band like so. And just grab onto it like that. Alright, so then you want to pull away from it just a little bit so you feel some of the tension, and then as you pull away, take your neck to the side, and you're definitely going to feel a stretch right through here, through the side of the neck, through the trap, feel a little bit in your shoulder. You want to hold this stretch for anywhere from 30 to 60 seconds, kind of just like as much tolerance as you have for it. If it's pretty painful, obviously, do it for about 30 seconds, and then you want to do it on the other side, of course, and maybe even a couple times to really loosen that up, and that'll hopefully alleviate some of that tension in the neck and some of the pain that you might be having. So So that's this week's Fitbit, and we'll see you next time.
Hopefully you found this video to be helpful. If you did, like it, share it with your friends.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.